Health and Human Services Secretary RFK Jr. defending his shakeup at the CDC ahead of testimony on Capitol Hill tomorrow, as hundreds of current and former HHS workers say that they want him to step down, signing a declaration saying, quote, Secretary Kennedy's actions are compromising the health of this nation, and we demand Secretary Kennedy's resignation. Secretary Kennedy writing in the Wall Street Journal, quote, the Centers for Disease Control and Prevention was once the most trusted guardian of public health, but over the decades, bureaucratic inertia, politicized science, and mission creep have corroded that purpose and squandered public trust. With that, we bring in Dr. Mehmet Oz, Centers for Medicare and Medicaid Services Administrator and part of this larger organization at HHS. Dr. Oz, it's great to have you with us. Thank you very much. Good to see you, Doctor.
It's great to see you as well. Let me just offer one little quote that
Please.
Secretary Kennedy offered us last week. We were in a staff meeting. It was actually from his father, and he said, progress requires change, but change has enemies. And the secretary is a powerful and strong man, and he has powerful and strong enemies as well. But he said from day one, certainly when he offered me this position at CMS, he said, we want to put the human back in Health and Human Services, and that should be the absolute focus.
Let me just read this to you. This is from the authors. This piece was authored by about 8 former members of CDC. Kennedy's decision to fire Susan Menarez as CDC director days ago is unlike anything that we've seen at the agency and unlike anything our country's ever experienced. Mr. Kennedy's fired thousands of federal health workers and severely weakened programs designed to protect Americans from cancer, heart attacks, strokes, lead poisoning, injury, violence, and more. What would you say to that, Dr. Oz?
It's an incorrect accusation. There's no question about it. Secretary Kennedy's focused on the American people. And so what he told me, I'll just speak from personal experience, but he said the same thing to Marty Makary at the FDA and Jay Bhattacharya. He said, make sure that your organizations are laser focused on the American people to ensure that they get the best care possible. In my agency, and we spent about $1.7 trillion, the major driver of that expense is the health of the American people not being good. If you have chronic illness, and that's one of the charges of the CDC to address these issues, you end up causing massive problems. So we pushed hard. And with Secretary Kennedy's leadership and the president behind us, we started putting MAHA initiatives into all kinds of things at CMS, more primary care doctors, making sure we do nutrition education, supporting whole new models for care that are based around MAHA. These work because you've got a strong leader willing to push the buttons on people who don't want change to happen. Now let's go back and look at the CDC, because I'm almost offended by that accusation that the CDC was in a good place. We all lived through COVID. COVID was a warning shot in many ways, but it was a catastrophic failure for the CDC. We all lived through manufactured excuses around mask mandates and 6-foot distancing, which didn't make sense. More notoriously and nefariously, the closure of schools, which hurt kids in a profound way, was that document was actually authored in part by the teachers union. I mean, these are ridiculous accusations if it make, except they happen to be true. And then you look at the fundamental reality that we have 4% of the world population and 19% of the deaths. Well, the CDC failed us. And without trust, you run into big problems. So Secretary Kennedy says, I need to revisit the fundamental first principles of this organization. How do we get the right people in leadership to make a difference so we can actually begin to improve the health of the American people, but also deal with the potential urgent crises of a pandemic coming back this way? And he's taking steps to make that happen. We do not have the luxury of weak-willed individuals. We need bold, decisive steps. That's what Secretary Kennedy's offering, and that's why President Trump wanted him in this position.
Yeah, I mean, when you look at the numbers that you just cited, are numbers that I had in front of me as well, because I think they're shocking, that 4.2 of the world's population is represented in America, but we suffered 19% of the COVID deaths. And there has to be a looking in the mirror and saying, are we achieving the outcomes for all of this money and with all of these individuals who are tasked with taking care of the health of America? And I think that it's, you really do have to live in an outcome-based world. Are you achieving results? And not necessarily in a world where the bureaucracy just continues along, regardless of whether or not you're receiving any of these results. I want to ask you about this because there's a lot of discussion about the childhood vaccine schedule. And today there was an announcement in Florida that they will move to end all childhood vaccine mandates in the state. That came from Governor DeSantis this afternoon, and it's in conjunction with the state Surgeon General, Joseph Ladapo. What is your reaction to that? And do you agree with that? Would you recommend the same thing to your patients?
I would definitely not have mandates for vaccinations. This is a decision that a physician and a patient should be making together. The parents love their kids more than anybody else. I could love that kid, so why not let the parents play an active role in this? There are some states now where you're seeing an increase in homeschooling because parents are running from the healthcare system. They can't get healthcare because doctors are unwilling to take the risk of taking care of children who don't want vaccinations because it might impact the way their practices are run. They shouldn't feel pressure from the government to decide what to do with the vaccination schedule. They should do what's the best interest of the person in front of them, let's say it's a child, and what those parents desire. That's how the system is supposed to run. But let's look at the trust issue that you raised so wisely. The CDC right now has a trust crisis, evidenced by the fact that despite until recently, a desire to get everyone vaccinated for COVID, only single-digit numbers of parents are vaccinating their kids against COVID. Maybe it's a third of the healthcare workers in the country.
Right.
People like me. Doctors are not taking the vaccine because it doesn't really seem to make sense to a person if they're young and healthy.
Yeah.
So if you're older, and Medicare, by the way, pays for vaccines, so my agency will pay for your vaccine if you want it, but why would I force you or put pressure on you to do something you don't think is in your best interest?
Yeah,
Study
it's
the
a great
literature,
point.
get your doctor's advice, do the right thing.
Exactly. A decision made between doctor and patient and not by mandate. And as you point out, even healthcare workers are not using them. Dr. Oz, thank you so much. Glad you could join us at the end of the show here, sir. Always good to see you.
Hey, Sean Hannity here. Hey, click here to subscribe to Fox News YouTube page and catch our hottest interviews and most compelling analysis. You will not get it anywhere else.